Hi friends, this is Dr. Ravi Kamapali. I'm an infectious disease, wound care and obesity medicine board certified physician in Augusta, Georgia. Just taking a break from the clinic that I'm at right now and had a thought that I wanted to share. The season of influenza is upon us, and we need to figure out how we should vaccinate ourselves in preparation for the combined pandemic and hopefully us preventing the influenza and COVID occurring together. And the risk of it, if we are following the COVID process of isolation, is that our influenza rates might go down. Now, but what that opens up is a Pandora box of us thinking, why do infections happen and how does this how can this process be prevented? Now, I'm trying to understand this and I'm trying to work on this process, but I wanted to quickly share my thoughts on it today and wanted to bring to the front the idea that we ought to understand where human evolution and human genetics are and how we can harness our own innate immunity to overall improve ourselves. Now, let me share a few things that I have tried to come up with, and I'll try to make sure that we will try to conclude this with some implementable solutions. So let me flip the camera a little bit. Okay. So this is the screen as of today, and this is the COVID CDC COVID tracker. And as per the number of total cases, see, you have them there, but I'm more interested in the cases in the last 7 days, 359,000 cases and 215 deaths. Now, that comes down to different numbers for different states, with the darker being the states that have been affected more. And obviously, the denser the population, I guess the denser the problem, with the Texas leading the number of cases, and California. And where I am located in Georgia, it is 8,000 odd cases, and South Carolina, Georgia border, where I am in Augusta, South Carolina has 5,000 cases. So that tells me, okay, it is here. They're talking about two kind of waves, you see. The waves of the problems that are there depends upon, did we even get out of the first wave? And now, is it all about just one virus, or is it about multiple viruses? Another good article that I came across from JAMA is COVID-19 pandemic. Is it just one virus or is it 16 trillion viruses? So, I mean, like, we talk about vaccines, we talk about putting ourselves through all this, finding the vaccine solution. The problem is we'll find vaccine solution for one vaccine, one virus, but then we have to understand that this virus has by itself caused us a significant cost. And now if it comes to the next virus, it's going to significantly affect a lot of other, including social, mental, and long-term health impairments, and how each one of us is going to be affected by it. Now we're talking about existence of this 19 million viruses, 16 trillion viruses, and trying to understand this process is huge. And we cannot go about trying to trust all the scientists of the world, all the bug doctors who come up with their own solution and stress and take all the TV time. But it just comes down to empowerment of each person. And that's what I wanted to quickly stress on, what I am trying to educate in Augusta. And what I'm trying to really telling us is we have been in this world and we have evolved over these centuries because we have been blessed with our innate immune system. And I had some opinion piece written in March And that's where I was talking about T cells. I can put a link to this video after I'm done to that article, opinion piece that was published. But I wanted to stress that the idea of this Facebook Live is to not be worried about the threat of what is out there, but how we can fight the threat. Obviously, masks, hand washing is the key. And this was my COVID-19 survival and thrive strategy that I advocate, and I use this as a teaching tool for all of my patients that I see in my obesity nutrition reversal process that I do for my patients. And I'm opening up this idea to the whole world. And this is simple. It is nothing something that I personally invented. It is a process that we have to understand that metabolic syndrome, which is a huge problem. Metabolic syndrome is nothing but these 5 criteria: waist circumference that is higher in men and women, where it is more than 40 for men, 35 inches for women, and low HDL and high triglycerides. This is the major problem. Most of us have high triglycerides and elevated blood pressure and blood sugar. If you have 3 of these, then you are at risk for metabolic syndrome. And that is a syndrome, but the real problem is insulin resistance. And nobody talks about that because they don't test and they don't talk. And once you don't look for any problem, you don't find it. Once you don't find it, you don't fix it. And the problem is out there in front of us. And how to fix it is simple. Obviously, there is going to be a bug of the day. For now, it is COVID. But what is coming out there is influenza. Influenza is also a problem. Now, the real pandemic is not COVID. The real pandemic or endemic is not going to be influenza. The real process is metabolic mayhem of metabolic syndrome. So let's try to understand how we can kind of biohack this, each one taking care of themselves. Now, simple process is to understand that obviously we need to reverse isolate ourselves. When we are in a group of people, try to stay away and do the Indian namaskar, or not shake hand but fist butt, or just say hi and then wear a mask. But that helps in reducing the volume of the virus burden to move from one person to another. And a mask help. Masks do help because it's a bulk of virus that is not transferred from one person to another. But at the end of the day, this COVID is a weak virus. We have to understand that this is a damn RNA virus, and that does mutate and it becomes weak. But what that weakness of the virus is helps it survive the innate immunity and causes our own metabolism to kind of become our own enemy. Now, how to improve ourselves is simple process. Please closely look at this. Is first of all isolate and improve metabolic fix. How can we do that? Is to reverse diabetes and hypertension. And to do this is simple, is to keep the carbohydrate, particularly the processed carbohydrates and vegetable oils, low. And eat nutrient-dense foods. And nutrient-dense foods are meats. And people tell, oh, don't eat meat. That's not right. We are animals. We eat animals and we grew because of that. We have to understand that. Whatever personal beliefs are, I personally don't eat beef. But the question doesn't mean I'm not telling other people not to eat beef. But, there are other things that we have to personalize a nutritional solution. So I'm not trying to promote any certain lifestyle, but a lifestyle wherein I can help improve each person at a time. And then that is so very much important. Now, the process is simple. Eat real food without sugar or juices, and fruit juices are bad. I'm sorry, Florida, but fruit juices are very, very bad. And now, the simple process, if you forget about everything that I talked right now, listen to those 3 things: what to eat, when to eat, and how much to eat. These are 3 levers of personal improvement that you can follow right now. Simply cut carbs, prioritize protein, fill with fat. I mean, like, I learned this from one of the nutritional luminaries in the nutritional world. I mean, like, I am learning as I'm growing through this process, and it has personally helped me. There are many people that I'm learning this from, and salutes to all of them. There are so many innumerable people that I owe my life to them. But the question just comes down to, I need to propagate the knowledge of healthcare delivery at one person at a time. And my journey is in Augusta is what I'm using to help one person at a time. And we have helped already 50 people here. And when it comes to next step, when to eat, it's all about fasting and intermittent fasting. Now, there are studies that are out there trying to confuse people, but understand that fasting and feasting and timing is huge, and you need a personalized coach sometime to help it if you're getting stuck with it. And understand that time restricted eating is very, very huge. And basically, what I want you to understand is that how we can help each other make this impact is huge. And how we can understand is simply get a coach if you don't understand much about it. And then basically the next step is how much to eat. It's about satiety. It's not about calorie counting. Obviously, calories do matter when you are eating too much. But when you talk about satiety is what we have to harness. And other skills, it simply need sleeping well, reducing stress, and hydrating well, and regular exercise, and a few vitamins here and there. And obviously, vitamin D seems to be very important. Vitamin K2 is important. Vitamin A is important. Zinc is important. And I'm a wound care doctor. I try to replace nutritionally a lot of things. And then coming down to this whole process of improvement, I try to make sure that I tell my patients, avoid these like processed vegetable oils. These are the lists of processed vegetable oils that are not good, and these are good oils that I promote. And basically it just comes down to one person at a time, how we can change world. And please understand that this is a journey, and I want to make sure that I share this journey with as many people. And as I learn through this process, I want to make sure that there's many things that are there in life. And I mean, obviously, we are forgetting that there is many organs in the body, and we in healthcare kind of siloed many processes. As a chronic care, as an infectious disease, wound care, and obesity medicine doctor, people ask me why I do what I do. And you are a bug doctor, why just cannot go about just treating bugs? But my problem is understanding what I understand now. It has changed my perspective. I'm more of a chronic care doctor right now, and I cannot just call myself a bug drug doc. And feel free to reach out to me. I'm at Wound Physician on Twitter. My website is aindiabetes.com, AIYAN diabetes.com. And basically, I am into using people, process, and technology to help as many people as possible in US, in India, and across the world, and hoping to make that impactful change, trying to partner with many healthcare solutions, and including local healthcare facilities that we are reaching out to. And making this impactful change is what we have to work. And healthcare is not easy. And I'm telling you, whoever is in healthcare during this time is very blessed. Take that ownership, take that process, and make that happen. I urge each one, and then I feel free to reach out to me, and we can make this happen. Thank you. Thank you for your time today, and looking forward to future endeavors. Don't be worried about what's going on right now. Worry about personal health, worry about your family, worry about your community, and empower each one in reversing metabolic syndrome. That's where the real impact is. That's where the real pandemic is, where we have to address. And I can only do this alone so much. Please partner with me. We'll make this happen. Don't worry. Be happy. Thank you very much.